Hello everyone, in this video we are going to discuss about Erb's and Klumpke's palsy. These are the brachial plexus injury. So in brachial plexus we know it consists of root, trunk, division, cords and branches. So whenever a trunk injury is there, this Erb's and Klumpke's palsy will occur. Upper trunk injury will lead to Erb's palsy and lower trunk injury will lead to Klumpke's palsy. So Erb's palsy, the upper trunk is injured. C5 to C6 division forms the upper trunk. So that is the level affected. It is caused due to shoulder trauma or birth injury, because whenever there is overstretching of the neck during the delivery of the child, it will lead to brachial plexus injury, that is upper trunk, leading to Erb's palsy. Next is the nerves involved are the suprascapular, musculocutaneous and the axillary nerve along with the part of radial nerve, because radial nerve gets its roots from C5 to T1. So C5 and C6 are involved here. So a part of radial nerve is injured. Here deltoid, supraspinatus, biceps, brachialis and infraspinatus are injured. So there will be no abduction, no flexion, no external rotation and no supination. So there will be adduction, extension, internal rotation and pronation of the arm and the forearm. So here waiter stiff posture will be seen. Arm adducted, internally rotated, elbow extended and forearm is pronated. Extension and pronation of the forearm, adduction and the internal rotation of the arm is seen. And sensory area lost is the sensory part is the lateral arm and the forearm, because it is supplied by C5 to C6. So in this, no sympathetic fiber involvement is seen. This is the waiter stiff position where we can see here arm is adducted and internally rotated and forearm is pronated and elbow is extended. And next, coming to the Klumpke's palsy. Here lower trunk is injured, that is C8 to T1 will form the C8 and T1 forms the lower trunk. So this is injured and it occurs because of pulling of the arm or in birth trauma where the arm is overstretched. Whenever during the delivery, if the arm is pulled and overstretched, it will lead to C8 to T1 injury leading to Klumpke's palsy. Ulnar and a part of medial nerve is injured. Intrinsic hand muscles and finger flexors are the involved muscles. So intrinsic muscles are the lumbricals and interossei, and here the lumbricals helps in metacarpophalangeal joint flexion and the interphalangeal joint extension. So reverse will happen leading to metacarpophalangeal joint extension and interphalangeal joint flexion, so causing a claw hand deformity. Here fourth and fifth fingers are especially very much clawed. Along with this, Horner syndrome can also be seen. So coming to a clinical scenario, a newborn baby is delivered by a forceps assisted vaginal delivery with arm hanging limply by the side. Arm is adducted, internally rotated, elbow is extended and forearm is pronated. So this is a waiter stiff position seen in Erb's palsy. So the diagnosis is the Erb's palsy. Next, a young adult falls while grabbing on a tree branch to break a fall, after they develop a weakness in the hand grip and clawing. So this is a Klumpke's palsy. And a patient also having Horner syndrome symptoms like ptosis and meiosis on the same side. So first one is Erb's palsy, second one is a Klumpke's palsy.